Welcome back, everyone, and welcome to our next session entitled Incorporating Integrative Medicine in Your Treatment Plan. This session will look at how integrative medicine can positively impact your life and be part of your treatment plan. For this session, we are joined by Dr. Rebecca Hauser, a naturopathic doctor at Ottawa Integrative Health Center, Paulette Hebert, a reflexology therapist, and Melissa Ng, a stage 3 rectal cancer patient. First, Dr. Hauser will share a short presentation and will then be met by our panel members. We will end the session with a Q&A. So please feel free to add your questions by using the question button to the top right of your screen as the session unfolds. Dr. Hauser, over to you.
Dominique, thank you. Hi, everyone. So I'm Dr. Rebecca Hauser. As Dominique had mentioned, I'm a naturopathic doctor at the Ottawa Integrative Health Center. I've been in a practice since about 2012, and my current practice is balanced with about 30 or 50% or so in terms of complementary cancer care, with the other 50% being balanced with fertility, pediatrics, and sort of general care. But given that about 50% of my practice does involve patients who are going through some process with cancer, integrating naturopathic or integrative medicine plans into their treatment plan is something we commonly work through. And so one of the things that I often hear very, very frequently from patients is that after being diagnosed with cancer and being presented those options of chemotherapy, radiation, surgery, or in some cases, watchful waiting, people start to ask, what else can I do? What else can I add to my care? And it's an extremely important question to consider. And so that's where we want to go through some of that information today. So one of the first things that we might want to look at is what is naturopathic medicine and what sort of areas of integrative medicine can we add to your treatment plan? If you're looking at working with a naturopathic doctor, what you're looking to work with is a regulated healthcare professional who has to graduate from a 4-year postgraduate naturopathic medical degree program, including an internship, and go through a whole bunch of licensing and board exams in the regulated jurisdictions. Some of us also have some additional training in things such as intravenous injections, other injection therapies, hyperthermia, and ozone. So naturopathic medicine itself, and the reason I go through that is that it's one of the larger areas of those integrative medicine plans, but as you'll see in our panel, it is not the only one. The naturopathic medicine and many complementary medicine protocols that we can add into your treatment plan are coming at an approach that blends evidence-informed medicine with those traditional and natural forms of medicine to support your body and stimulate its ability to heal itself. So this can encompass a whole bunch of different modalities, which I've listed up on the screen here. So it can be something like working with you through your diet, through lifestyle counseling, nutritional counseling or supplementation, all the way through botanical medicine, acupuncture, and Chinese medicine, and also encompasses many different injection therapies, including intravenous therapies like high-dose vitamin C, other injection therapies such as the mistletoe injections, and additional or advanced testing. So some of those tests and that's commonly a question we get is, well, what other testing can I do? And so with naturopathic medicine, one of the areas that you can always discuss with your practitioner are additional tests that can be done outside of your conventional care plan. So things like circulating tumor cell testing, oncoblot testing, or Dutch testing. One of the key or core values in naturopathic medicine is individualized care and developing treatment plans that are not only based on a patient's cancer type and stage, but also on them as an individual and their specific life circumstances. So one of the things that we want to do is tailor a plan using these other modalities that fits you, fits where you are in your life, and the other therapies that you may be using. So before we go through that, though, there's often numerous common misconceptions that may come up about naturopathic medicine and integrating any sort of treatment plan or complementary care plan into your health system. And so one of the biggest ones that I often hear is that it has to be an either-or approach, meaning I can do chemotherapy or I can look at working with a naturopathic doctor, not necessarily doing both. And it's actually quite the opposite from how the vast majority of integrative health practitioners work. So we're here to support you as the patient in whatever way is best for you and whatever way is best for your healthcare. And so quite often what we actually do is encourage a very open team-based approach. So one of the major things that we do as naturopathic doctors is actually to try and help coordinate your care and make sure that you have open and professional lines of communication between ourselves, your conventional care system, and any other complementary care providers. So that benefits you as the patient, and it also benefits the overall treatment plan that we're trying to develop. So it's a 360 treatment plan instead of just this one approach or this one approach or this one approach. Another common misconception is that naturopathic medicine or any complementary care protocols are not information or science-based. Typically, what I say is that it's actually an evidence-informed approach versus necessarily only an evidence-based approach. So what this means is we use what research is available, and there's actually a very extensive amount of research into natural therapies and specific medications, and in general with complementary cancer care. And we use that information to tailor a plan to you and the specific medications or treatments you may be on, using what research is available, and then also an understanding of the mechanism of action of any treatments we use, as well as the other treatments such as medications that you may be on. Another common misconception is that naturopathic medicine is only for healthy people. And while it would be ideal to work with prevention, more common, we get patients coming in saying, "You're my last hope, you're the last stop, what else can I do?" And so while I would love to work with people only in terms of prevention, it is most common that we get patients coming in with specific health concerns. Also, people often are worried that they're going to have to change every part of their life. They can no longer have sugar, they can no longer have coffee, and they're going to be vegans. And while there might be significant changes that we discuss, every treatment plan is tailored to you as an individual, because not only does it need to be maintainable, it needs to be manageable for you. And your treatment plans should not add significant additional burdens to your life or your healthcare plan. Depending on what jurisdiction you're on or in, it is sometimes a discussion of a common misconception that naturopaths are unregulated professions or professionals. Typically, we are regulated healthcare professionals that are monitored by a specific college. So in your resources page, along with this presentation, there's a one-page handout that speaks to where to find a licensed and regulated naturopath, both in provincial and national associations, as well as an association that regulates the naturopathic oncologies or naturopathic oncology physicians within North America. So now that we've decided, you've went through, maybe I want to work with a naturopath, kind of have an idea what naturopathic medicine is. We've went through some of these common misconceptions. The next thing we want to look at is what is actually complementary cancer care. So each patient's condition is very unique to them. And one of the key components of complementary cancer care is individualized approaches and treatment plans that are tailored specifically to you. So whether you choose to do naturopathic treatments in addition to your conventional care plan, before or after, or if you're looking to do the natural route only, there are definitely treatment options available. So I've listed some of the most common goals for complementary cancer care that patients seek out. However, it's often a combination of these that we use with patients. So an example of this would be many patients come in looking to boost their immune system and keep themselves as strong as they can before they started conventional therapy such as chemo. And then they want to decrease the side effects of those treatments and work ideally on secondary prevention when they are done their treatments. That allows us to come at many different approaches for naturopathic medicine. And one of the other areas that sometimes comes up very common is that, well, I've done all these things, but I'm still left with this symptom or side effect. I have some pain. I have now been said that I'm in remission, but I'm having issues with bowel movements or pain with intercourse or certain other specific symptoms that come up. If that's the case with that complementary care plan, it also will bring up discussions of who else can I work with to make sure that we have as high of a quality of life after treatments as possible. So there are many different avenues for complementary cancer care, regardless of if you are working with your conventional care system, working with only the natural route, or looking to do a combination of both. So one of the next things, now you've decided, I want to add this into my plan. What kind of things do I need to think about? What are some important aspects to consider when I'm trying to decide which practitioner to see or when I should start seeing them? Probably the biggest thing to consider is what are your goals of treatment? So really deciding, what do I want out of these treatments? What am I looking for from this practitioner? Are there specific therapies such as IV therapy? Am I looking specifically for diet or meal plans? Do I want only to work with my symptoms or side effects? So all very, very good questions to ask yourself and to find a practitioner who focuses in those areas. So one of the biggest things we always want to look at is, do the practitioners that I want to work with Do they treat cancer? Do they treat patients with cancer, with my specific cancer type, my specific cancer stage? And are they able to individualize my care to that? The benefit of working with somebody who is comfortable in the cancer care field is that they will be up to date in the research. They'll know how to manage a lot of the common side effects or symptoms that come up, and likely already have a relationship with other practitioners in your care plan, which takes a lot of the burden and stress off of you, in that there will be an open line of communication so that everybody is on the same page. So now that we've decided that that is the approach that you want to look at, what are some of those next steps you want to look at? In that one-page resource will give you a list of information on where to find a regulated licensed naturopath, some common questions to ask, and once you have your goals in mind and you find a few practitioners you'd like to work with, see if any of them provide free meet and greets so you can get a feel if you match them both for your specific health concerns and that you feel comfortable working with them as an individual. From there, you'll be all set to incorporate integrative medicine into your treatment plan, and we can take it from there.
Thank you so much, Dr. Hauser. Now I'd like to turn it over to our panel to introduce themselves to the audience. So maybe let's start. Melissa, could we start with you and hear a little bit more about you and your story?
Hi, my name is Melissa. I am 38 years old and I was diagnosed with stage 3 rectal cancer in September of 2020. And I have gone through chemotherapy and radiation. And I've been fortunate enough that when they looked at my last scan, the tumor that I had there has shrunk quite a bit. So they're really, really pleased with the results. So I'm super, super happy about that. I think the chemotherapy and the radiation did really, really well. And I'm very passionate about natural alternative treatment as well, because I do think that that helped me so much to get where I am today.
Thank you, Melissa. And now maybe to have Paulette, can you do the same? Can you introduce a little bit yourself and what you do?
Hello, everybody. It's a privilege for me to be able to introduce reflexology to you. Some of you may have heard of it. Hopefully some of you have experienced it. It's a therapy that is natural and non-invasive. It has been around for thousands of years and is now becoming more popular in North America. It's definitely a complementary therapy, and it's something that taps into the side of your brain that helps you to relax, to recover and repair. It's a very soothing type of therapy. We would be applying pressure on either the feet or the hands, so depending on your preference. And we have the whole body that is mapped out, and we apply gentle, soothing pressure. And by doing that, it's working with your nervous system, helping your body to relax and repair. As Dr. Rebecca has mentioned, we certainly encourage people who are thinking of introducing or including reflexology in your cancer care to discuss it with your doctors and your cancer specialists, and to make sure that you seek a registered or certified therapist. This is very important. We've had special training and know how to adapt our sessions, our treatment to cater to your needs and the type of cancer treatment that you're having. In certain hospitals, for example, in the UK, in USA, in Iran, they do have reflexology therapists on staff in the hospitals. We're not there yet in Canada. So I do encourage you to maybe look into it and consider it. The nice thing about reflexology is that you simply take off your shoes and your socks, you sit back in a chair, and you relax. We can do it on your hand or on your feet, as I say. The reason why I'm so enthusiastic is that myself, I have had breast cancer and reached out to reflexology to help me get through it. We don't cure, we don't diagnose, we simply complement your journey in your cancer recovery. I've mentioned the chair. This is type of therapy that is another benefit to consider, because you don't need to be lying on your front if you've just had breast surgery, or if you're experiencing a lot of bloating or discomfort. You can just sit back. The great thing, you can get reflexology in clinic settings. I myself offer home visits, which is very convenient. You can be sitting in your home, very, very comfortable, and get this soothing, this very beneficial therapy. And if there's any questions, I'll address them as we get to that section of the presentation.
Thank you so much, Paulette, for sharing a little bit more about reflexology. So maybe we can learn a little bit more as we have the discussion. Maybe to kickstart that discussion, maybe I would turn to you, Melissa, in terms of, as a patient, can you share with us a bit more how you have incorporated really integrative medicine into your treatment plan, and how you've achieved doing this?
Of course. It was an alternative practitioner that encouraged me to get the colonoscopy at the beginning when I first had my symptoms in the summer. And I'm not a stranger to alternative therapy, so I was seeing a traditional Chinese medicine practitioner. And when I described the symptoms to her that I was dealing with, she said, you have to get a colonoscopy. Like, I can't do anything. So she really, really forced me to go and do that. And for that, I probably would be in a worse off place than I am today. Once I started chemotherapy, I sought out a naturopathic doctor that had oncology experience. And I thought that was super, super helpful, because they work with you to see what your side effects are, and how they can help prevent side effects from happening, or any symptoms or anything that you're having. And I also find that when you go to your doctor's appointments, sometimes you don't understand everything. But what I really felt with the naturopathic doctor was that she was able to sort of just explain things to me a lot better in terms of my blood work and some of my results and my tests. And they came up with the most amazing treatment plan for me. So I've been on herbal supplements, and I've been on a whole bunch of different complementary treatments throughout this entire journey. So I'm really passionate about it, because I do feel like my symptoms and where I am today I have the naturopathic doctor and my traditional Chinese medicine practitioner to thank for it, because without them, I probably wouldn't be as good as I am today. Even the doctors are amazed at my results. And they can't even believe that I've gotten this many things coming from that, and they can't believe that that my tumor is no longer visible. And I believe that it's from the things that I've been doing that are complementary to the treatments.
Thank you so much for sharing, Melissa. One thing that you also mentioned is that you're not a stranger to integrative medicine. So you've used it. And so is there anything you can share with the audience in terms of how they can, if it's new, how they can find these resources?
I think word of mouth is really good too. And people that have gone through similar experiences in the past. So that, and also to find a good fit. So meet and greets, like Dr. Rebecca said earlier, meet and greets so that you could see if you're the right fit for that practitioner. Sometimes there's not like a great connection, or maybe, and you want them to work with what your goals and your values are. So I wanted to go traditional medicine route. So I went ahead with traditional chemo, radiation, but I wanted something to complement that. And I think the best thing that I can say is just ask people in support groups, chats, I started a blog to talk about my experiences. So people have messaged me and asked me who I recommend for, how do I find somebody? What do I do? What do I need to do? And I do think that that's got me to the place that I am now.
Wow, thank you. This is so valuable in terms of how to do that. So providing a lot of information. Maybe then, again, a little bit a similar question, but maybe Paulette, you could share a little bit with us in terms of professionally how you incorporate integrative medicine into their care plan when you see patients.
Definitely. I mean, a big thing with reflexology, the fact that we're tapping into the side of your brain that's pushing you to relax and repair. I mean, when you get your diagnosis that you have cancer, I mean, anxiety and stress just shoots to the sky. And so if you have something in your treatment plan that can help to relax you, it will make a very big difference. I mean, it will help with some of the side effects with chemo. And while you're going through all your procedures and so forth, it helps you to feel empowered, and it helps you to feel that you're in control of some of the bits of your situation. And if it can help you feel better, this will make a big difference in your healing. I mean, in terms of addressing anxiety, stress, some of the bloating, reflexology can help a person that. So the empowerment aspect of it, I find, is very important when we're talking about cancer care. There's so many decisions, and some of these decisions are so fast, and some of them you hardly know what's going to be happening. And so if you're feeling that part of it helps to ground you, that makes a big difference.
Thank you so much. I'm hearing from all of you complementarity, the need also to be a little bit pampered, the need to be able to have someone also who explains things differently, being in control. Dr. Hauser, anything to add in terms of that integration into treatment plans from that discussion?
Yeah, so I think kind of to tie in with both what Paulette and Melissa were saying is it's very important to find a modality within that complementary care or multiples that both match your goals, so your health goals and you as an individual, and that you're finding a practitioner that you have a good rapport with. Because part of that complementary care plan is to have your goals and your needs met, but it's also that therapeutic relationship you have with that practitioner. So do I feel comfortable? Do I feel like I'm empowered, like I'm being given back some of the control of my situation so I can make informed choices, both for the complementary side and some of those more conventional therapies? And so that, I think, is one very, very important thing. The other part is, Paulette mentioned earlier, is to make sure that whoever you see is somebody who is a regulated professional in their field. And it is someone who has treated not only patients with cancer, but ideally your cancer type. So that, again, they can have those treatments that are aligned specifically to you and your goals. They can tailor plans to you. And if they really need to refer you to another professional, they have a network in there so that they can say, yeah, you know what, you heard about so-and-so on that support group? He or she is excellent. They tend to do this and this. Or he or she is excellent, but they treat maybe, breast cancer almost exclusively versus colorectal cancers. Or, they work more with men or with women, pediatrics or adults. And so having a practitioner who works in that area, in that field of complementary cancer care, can really help kind of streamline some of those big choices and decisions and that information load that comes at you. And I think that's one of the values of working with a complementary care team as well.
Yeah, that's great. And maybe to build a little bit on this, because I'm hearing all your openness and the value of integrating this into your care plan. But Dr. Hauser, maybe to start with you, what's your experience when you build those care team or you work with other practitioners? What is the receptivity in terms of integrative medicine?
So I would say it depends on where you're practicing, and quite often it may be a little bit more difficult initially But then as we have that open and professional line of communication, as anybody else on that care team starts seeing that the patients and their goals and values are the absolute priority, it starts to become a much, much easier process. And so one of the things I think that's also beneficial, say, with working with a naturopathic doctor, is that we're not only sort of that quarterback, or we can act as like that quarterback role for your complementary care team of saying, okay, we're going to organize the care, we're going to give you the information to make informed choices, but we can also then take some of that burden off the patients of taking that communication to your conventional care team and having it in a very open, organized, professional manner, so that your conventional care team knows exactly what's happening on the complementary side and vice versa. So that way everybody is on the same page and everybody's aligned to fit your goals and your needs. And I think that's really important, because it takes some of that stress off you as the patient. You're going through enough stuff, right? Like, you're going through this massive health concern. You shouldn't have to then research and investigate and communicate every single key piece if one of the practitioners is able to do that and just have it in one nice, organized, like concise fashion that we can inform everybody on your care. Yeah.
You're kind of that connector also with those regulated resource you were talking about. You can become that for the patient. Is that correct?
Yeah.
Okay. And Paulette, maybe anything to add in terms of you as a reflexology therapist? Is there how you kind of how you work and how you have that collaboration with professionals and healthcare professionals?
Yeah, I mean, in terms of the coordinated team, and live and work in the same clinic as, can share and discuss the case, and maybe that gives me insight to add into that patient's session, and it also allows me that some reflex treatments that I do are not having the effect, or for example, before the lockdown, where the person said to me, I'm really struggling mentally. Like, my mental health is really taking a knock here. So I could say, listen, there's someone within our team that you could go and speak to. And this is so nice to have this gamut of different services, different types of therapies that we can refer to our clients.
And do you feel like the receptivity from either the oncologist or the patient physician that are following them in terms of being part of the team around the patient?
Yeah, because the thing is as the patient is going through the different procedures, there might be things that I need to add, I need to remove from my hands. If there's side effects that are presenting themselves more than others, there's different things that I will need to adjust as I do my treatment. And so that all around approach, it really caters to all the needs of the patient. It's not one model that fits everybody. It's very much catered. And I think that's what a lot of people enjoy, is that you'll get 60 minutes with me where it's 60 minutes of my full attention. I'm listening to you. I'm feeling things, in your feet or your hands. I'm able to really cater it. And that's just amazing, because it's not just one template that fits everybody.
Thank you, Paulette. Melissa, as you're listening, you alluded to the fact that your Chinese therapist got you to get back to the traditional kind of, I would say, route to be able to be diagnosed. So can you add, from a patient perspective, what is kind of that collaboration? How can you instill that in becoming like a holistic treatment plan that is both from your traditional but also the integrative medicine?
Well, I think for me, because when you're first experiencing symptoms and you're young, or maybe you're in denial, basically, and you don't want to admit things wrong. So I just thought, okay, I'm going to go to her, because I'd already been seeing her and we have that bond and that relationship, and I already trust her. I was seeing her for headaches prior to this and just hormone regulation. And I said to her, can you do something for this blood? in the stool. And she said, no, like that's no, you need to go to your regular doctor. And I said, no, like, please don't, like, I don't want to do it. Please. Like, she's like, please promise me you're going to go. Call right now, call today, get the requisition, go to your regular. And I really didn't want to do it. I did, but I only did it because she told me to do it. And I think I would have let it go on. Seriously, I would have let it go on for months without, I just thought she would be able to do something, but the trust that I built with her, and the fact that when I got diagnosed, she was right there for me. And she was like, okay, we're going to focus your treatment on helping with the side effects of the chemotherapy and the radiation, because I was in a lot of pain and it just wasn't comfortable. So she helped me with managing those effects. And I think mentally relying on this is what saved me, because you don't have any control over anything that you do when it comes to cancer. And this is the only thing that you have some control over, because you can work with someone who is collaborating with you to come up with a treatment plan that works for you, versus someone telling you need to do this, you need to do that, you're going to go on this chemo, you're going to do this. That's fine, I'll do it. But you have no control. When they say you're going to need 12 treatments of chemo or 5 treatments, you don't have a control. So this allows you to have some sort of, it helps you mentally a lot to just trust your alternative medicine practitioners. Trust them, collaborate on your treatment plan, where a lot of traditional medicine, it's hard. They don't have it. You say you don't want chemo and they're like, no, like you have to have it. So developing that relationship and that bond, and I'll still go. Like, although I'm better, which I'm not better, but although I'm in the right direction, I feel like I will continue going no matter what, because mentally it's helped me so much.
Thank you so much for sharing this testimonial, Melissa. I hear and it's not only about integrative medicine, because I'm hearing as you hear all of that, all the emotion, all the overwhelm and the tsunami of the news, it's that trust, that kind of hand that helped you go through it throughout the treatment. So it's not only the medicine, but it's also the trust and the person. So thank you for sharing. So maybe before we go to the audience, I would ask each of you to maybe what's the one thing you want to share and leave the audience with before we go to the Q&A about incorporating integrative medicine into your care plan. Maybe we can start with you, Paulette. What's the one thing?
I think, now that, you get your diagnosis and your doctor, you have to do this, you have to do this. And just the fact that you have another door with options, that makes a big difference, because, some people say the experience, like they just took me and put me in my room and they operated me and I didn't even know. You feel like your body, your soul, and your mind are completely disconnected. By integrating it, it really, it's such but it allows you to be whole again. And this empowerment thing, I can't say it enough.
Yeah, thank you. Melissa, do you want to share what's your one thing before we go to the Q&A?
I would just say, why don't you try something in order to get the peace of mind of knowing that you've done everything you can to help your body heal. So I want to leave this experience knowing that I did everything I can, regardless if it works or it doesn't, or this worked for you or it doesn't work for you. You did everything you can to set yourself up for success. And the mental relief that you get from that is priceless, in my opinion. So I think it's worth it.
Yeah. Which I hear from all of you is very important, to have that kind of empowerment, control, mental wellness. I think, again, I'll leave Dr. Hauser to close, but I think, Paulette, you wanted to add something.
You go through chemo, you might have surgery, or you go through cancer, you might have surgery, chemo, radiation. It doesn't stop there. Your healing starts after that. And that can be a long journey. And that you want to make your own, because you're taking control of the new you. And this is why, by having other options, and one treatment is not going to cure cancer. You need different approaches, different branches to include in your recovery plan.
Thank you so much. Dr. Hauser, what's your one thing you want to share before we go to the audience?
Thank you. So I think both of those points, Melissa and Paulette, thank you for your kind of thoughts on those, because those are amazing. And I think they're so important and valid. The one thing that I would say is something that Melissa touched on, which is making sure that whatever practitioner you find, that you have a good relationship, that you feel comfortable, that you feel trust, and that, like as Paulette said, right, like, yes, you want them to be professionally, like you want them to be regulated, and they need to have that professional and educational background. But as an individual, you still have to have that relationship and that fit, because it's as cliche as it sounds, it is a journey, and it is something that is both mental and physical and spiritual. And you have to have a connection with that practitioner that's going to work with you along that path, versus just having a plan or a protocol, or just feeling like you're another number or another person. Having that strong therapeutic relationship to treat you as an individual, to treat you as a person, and to match everything to your goals is so important.
Thank you. I hear so much humanity in everything you shared. So thank you so much. And now I suggest that we open the floor to the audience and go for a question from the audience. So for the audience, I'm here to make sure that your questions are answered. So continue kind of populating the question tab on the top right of your screen. So we have a few questions for you. And maybe starting one question for you, Dr. Hauser, is what are your thoughts on combining the IVC with IV mistletoe and keeping them on separate days? Like, do you have anything to share in terms of your perspective there?
So I'd say I kind of vary it depending on the patients and their specific concerns, other medications are going on. So like very specific, like treatment recommendations like that, I find often really very patient to patient. Typically I do separate them day to day, just because I find otherwise it can be a lot for patients. And just, I guess the type of patients that I see, they tend to do better having them separated. But I also know some excellent practitioners who do them side by side. So I wish I had more helpful info, but it's a very like individual, like case specific, where I do some together and I do some separate.
Yeah, no, and that's great. Maybe to build on that, because there's another question from Fabienne who's asking if you have some studies on the efficacy of mistletoe on colorectal cancer.
So if you go to like the Helixer, the mistletoe, one of the big companies for mistletoe, if you go to their website, they actually have all of their studies and all of the independent studies listed on there. So there are some in colorectal cancer. Again, it's not like there's 100 of various different stages, but there is a couple good quality ones on there that you can look at. If you have access, so if you're a healthcare practitioner and you have access onto PubMed, you can find them there. But what I like with Helixer, which is one of the main companies for mistletoe that we can get in Canada, they just list it right on their website. So I usually direct people to that website. And if it is helpful, because I actually don't have it on hand right with me, I can always email it to you guys as the coordinators, and then anybody who's interested can check that. But it's Helixer, so HELIXOR. And so if you look them up, their website comes up and they have entire pages for patients where it goes through references like that.
Okay, that's great. We also have, maybe for the three of you, and maybe Melissa, again, the question was asked to you, Dr. Hauser, but I think that the whole panel could answer this question about how would you suggest to approach an oncologist that is not supportive of integrative medicine or having things like IVC and mistletoe? So maybe Melissa, like as a patient, is there something that you have any tips for the audience in terms of how to do that?
Well, I think it's funny because the oncology doctors, like sometimes they don't really approve of a lot of the things, but if you ask the oncology nurses, they're all about it. Like they will say, okay, you know what, I think it's a great idea for you. Go ahead. Some of them are more resistant to others. In my care team, I have 3 doctors, radiation doctor, my surgeon, and my oncologist, and I found that the oncologist is a little bit more resistant, but the nurses, like the oncology nurses, you get to know them because you go in there so often, and they're a lot more open, and they're a lot more, they're able to say, okay, yes, try it, do whatever you have to do. You know, like I've heard really good things about this. So they're just a lot more open.
Yeah, discussing it with them. Is that a little bit the same? So maybe Paulette, is that a little bit what you're hearing also in terms of how to get that openness about integrating and some of the complementary medicine? I think you're on mute, Paulette.
Okay, sorry.
Yes, now we hear you.
In this, can you hear me now? Yes?
Yes.
Okay. In this circumstance, I do have the professional experience and the personal experience of having gone through it myself. The way I would go about it, and Melissa is right, a lot of the oncologists are resistant to it. I would say to them, you know, are we okay to have me go out and try it? Let me just go out and try it and see if it does make a difference or not. And, you know, in my case, my doctors didn't really know anything about reflexology. And I said, you know, let me go try it. I'll come back and tell you if it's working or not. What we had to do is we had to look at when my chemo sessions were and when it was the best time for me to go for reflexology, because you do need to let all these medications do their effect. So that was important. And we found the balance through that. And by the end of it all, they were saying, maybe we should consider making this part of the multi-dimensional approach. And so, like I say, we're not there yet in Canada. And hopefully more and more doctors. I mean, I found an oncologist in Montreal that when I said, listen, I'm having issues with lymphedema in my left arm, what do you recommend, massage or reflexology? And he said reflexology. And so I figured, bingo, I'm in the right place. But it's just having that discussions. And if there is resistance, say, let me go and try it. And if it's not
taking control,
the right effect, if it's not the right effect, then fine. But let me try it.
That's great. And taking a little bit of control, like we said at the earlier of the day. So maybe there's a couple of questions also for you, Dr. Hauser, that are more on the kind of combination of treatments. So one of them was, can you give IVC with FOLFOX or FOLFIRI protocols?
So we can, but what we always have to do is really look at what's called the half-life of a medication. Because I agree with Paulette, if you're going to take these treatments, you absolutely need to make sure that they're going to do the effect that we need them to do. And so usually what we'll look at is, what is your treatment protocol? How far apart are those? And where is it safe to give that IV? So with the vitamin C, its half-life is typically about 6 hours. So it's eliminated from your system pretty quickly. We have a much longer half-life for the FOLFOX. And so what we have to do is we have to look at specific timing of, if we're going this while you're in active chemotherapy, when are we going to time it? And so when it comes to that communication with the oncologist, where that becomes important is, say, myself as the practitioner, I'll write up a letter and say, okay, these are the treatments we propose for this patient. This is how I'm going to time it, taking into consideration this half-life, this potential interaction, and just write that out, and so that they can see that you're keeping that safety and efficacy perspective in mind. And you're saying, this is where I can add it. This is where we know the research of, maybe we haven't done a study of those two exactly together, but we know how long and when is this having an action, how long and when is this having an action. So we can make sure that there's no overlap. Yeah. So I wouldn't give it we wouldn't be doing the vitamin C timed in around close to the FOLFOX administration, of course, but you can kind of space and time those apart. Some people, when we space and time that apart, you can also say, okay, well, instead of doing having them this far apart, maybe we're going to do a lower dose infusion. So not the high dose vitamin C. So vitamin C has different actions at lower doses versus the high dose vitamin C. So an antioxidant effect versus a pro-oxidant effect. And so sometimes it's not just the timing, it's actually the dosing we really need to look at for safety and efficacy around treatments like FOLFOX.
Okay. Yeah. Thank you so much. And unfortunately, we're going to have to close the Q&A. Like there was a few other questions, so I think we're going to capture them. So for the audience, like hopefully like with the colorectal Cancer Canada community and the website, like you're going to be able to find a bit more of those resources, because that's the start of a discussion. So I just want to thank you all for sharing so many things about how you can do that, how you can collaborate, and really, again, I hear a lot about that control, part of taking control on your treatment plan. So for the audience, we're going to have a 10-minute wellness break. Take the opportunity to maybe visit the exhibit hall or go to the photo booth, because we would like to have that mosaic of great pictures of everyone. So if you haven't done so, please do that. And let us all be back in 10 minutes for the last session of the day already, during the conversation on building a resilient healthcare system. So we're all looking forward to seeing you all in 10 minutes.